Hi everybody, RNRickesha here, coming to you today about a post someone made in a nursing group that I'm a part of, and I'm going to share it with you all. This young lady, her name is Karen. Karen said, any other students freaked out by the nurses on other Facebook pages like funny nurses who hate their profession? I feel like all I ever see is a ton of negativity. I'm about to completely turn my life upside down to go to school full time and get into a bunch of debt. I would really love to hear from nurses who love their job. Okay, well, I'm a nurse that loves her job. So I felt that it was appropriate to address this because I hear it a lot, and I do know I could see why you would assume that maybe we don't really like what we do. Because you do hear the little jokes, the memes, and there's truth to all jokes. There's a saying that says that. So I want to answer, do nurses hate or love their jobs? Number one, I think most people can say that I love my job, but there are moments that we hate. Overall, becoming a registered nurse, I believe it was the best career decision I've ever made, not only for myself, but my family and my future. At the time, when I graduated, I did not have a son. However, now I do have a son, and it's been able to be where I don't have to worry about a job because I don't have to have a job. I have a career. And, what you can do, you can always usually find another nursing job, but what you cannot usually do is always just jump from job to job without some type of licensing or something. Number two, what we hate, there are things that I think with any professional, with any job that you might not like, or you would say hate is a strong word, but I would say what we don't like are high staff-patient ratios, meaning there's an issue with staffing in healthcare pretty much everywhere. It's a crisis right now, hence why I'm very passionate about really working to get more RNs into the workforce. But there's also a need for more diversity in the registered nursing arena. Patients like to see people who look like them, talk like them, and that's just where we need more diversity. And because the nursing population, they're aging, so we're going to be needing more registered nurses specifically. So it's definitely something that we don't like, is having a high patient staff ratio. Another thing we may not like is poor working environment. Most of the time it's not that we don't like being an RN or an LPN, it's that we don't like where we're working. We don't like the co-workers. It make it difficult to want to get up and come to work. We love the patients, we love the residents, we love everything we do as far as nursing care and providing care, which has made it such a wonderful career. But the thing they probably complain about is the job, not being a nurse. The other thing they may not like are poor working conditions, meaning I don't even have the supplies I need to do a wound dressing. I don't even have the staff that I need to make sure my residents or my patients are safe. Therefore, it puts my license in jeopardy. So no, they may come out complaining or acting as if they're not happy about that, because it's not the particular being a nurse, it's something that we can't get around. Another thing would be the work schedule. When I was first starting in nursing, I worked 12s. I think I worked 4 12-hour shifts in a row, then I would be off 2 days. 2 days goes by very fast when you've been working 4 12 straight in a row. Hence why I had to get away from that. And that's going to go into my next subject, that if a nurse is experiencing burnout, if she or he are not liking their job, it's time to do something different. Be a school nurse, do home health, do anything that can make that feeling of burnout possibly, which may be what you're experiencing. You're burned out of that place, you're burned out of that facility, you're burned out of that discipline, whether it's critical care, emergency, neonatal, PICU, ICU, whatever. Switch up. Another thing is being tired all the time from that. Again, quality of life. When your quality of life may be affected, which is all choices. You may need to switch it up. When I had my son, I couldn't do 12s anymore. I have to be trying to find somewhere that I could work that was flexible with my schedule. And that's what I did, which is why I'm teaching now. I love teaching. It still gives me the access of nursing. I'm helping other people become nurses. And so it's just really been a very full circle moment for me. So what I'm getting at the end of this whole conversation, and why I want to address that latest question, is that most nurses, they don't like being a nurse, and I can guarantee you they may complain, but they're not going to probably change their career. And then it could be some that, just like with any other career, if you got into this career for the right reasons originally, not for money, not for, it's convenient or something like that, because there's nothing convenient about nursing. Because we are in a position of nurses, they're in a caring profession. We are carers, we're givers. So a lot of times you may have to overextend what you may be comfortable with sometimes. And in that position, it takes a lot, and it takes a special person to be a nurse. So what you're hearing, caring, it's not that people don't like it. We love it. Hence why also we've been voted the most trusted profession for several years in a row. People trust nurses because guess what? You don't trust people that don't seem like they're happy or they're enjoying what they're doing. They trust us because we love what we do. So again, sharpen your own saw. Even when you're in nursing school right now, don't be afraid about going in the dead. Don't be afraid about those things, because guess what? With nursing, there are options which I took advantage of for you to get loan repayment. All professions don't have that. You understand what I'm saying? But maybe for that loan repayment, you have to go to a high needs area. Going to a high needs area, you think it's going to be peaches and cream. So maybe that's why they're complaining. But again, every profession has its ups and downs. My core values and what I wanted you to take away from today from RNRickesha: nurture yourselves, diversify to prevent burnout, and stay positive. What you do every day as you're becoming a nursing student, and going to be an RN, is going to help somebody else as well as their family. So we love our jobs. Nursing is a wonderful profession. Don't be afraid of what you may hear. Ask the questions. What made you say that? Or maybe they were having a bad day. Again, this is RNRickesha. Hope this helped you understand what we may be hating and what we love about being nurses. Look me up on Facebook, RNRickesha. Check me out on my website, rnrickesha.com.